Welcome, everyone. I'm Dan Czech, Vice President of Insights at KLAS Research, and I'm glad to have you with us today. We're diving into a topic that's top of mind for many in healthcare right now, federal policy. During today's webinar, we'll be sharing key findings from our most recent research report, Navigating the Uncertainty of Federal Policy 2025. I'm joined by my friend and colleague, Emily Paxman, Senior Vice President and Managing Director of Consulting here at KLAS. Emily brings a wealth of experience to the table, having spent over a decade helping healthcare stakeholders, including providers, payers, vendors, and investors, make more informed decisions. I'm excited to unpack the evolving policy landscape, what it means for healthcare organizations, and how leaders across the industry can best prepare for what's ahead. Let's jump in. Well, Emma, why don't we talk first about the genesis for the study, why we took time to invest resource and energy at KLAS. This isn't something we typically would do, but one of the things that always drives our research is what are we hearing in the industry? We like to keep our finger on the pulse of what's important with healthcare providers and healthcare payers, vendors. And this is a question ever since really the election that organizations have been asking us. What's going on? What are decisions that my peers are making? What should we expect that they're going to be doing with technology over the next little bit? And how should this inform our strategy and our decisions so that we're not left behind with our peers? So that's the genesis for this research. I think something that's really important for us to put out there as context for this, Emily, is that KLAS is not policy experts. We're never going to get deep into the nitty-gritty of every law that's passed or every executive order on the table. But what we are experts at is customer satisfaction, customer sentiment, and what that means for healthcare organizations. Was there anything that stood out to you as we get into this conversation? What were some of the most impactful things that you learned?
Well, we asked a lot of questions about specific reactions to potential policy changes and impacts, reactions and contingency plans to those things. But starting at a higher level, one of the things that stood out to me was just the level of uncertainty that exists in the market, as well as the degree to which organizations are, in the face of that uncertainty, still willing to take action. I think that's a holdout potentially from COVID, where very recently we were faced with a situation where we did not know what the plan was to respond to something like this, and organizations had to figure out how to make decisions without knowing all the answers, not knowing the best practices, which I think is very similar here. So one of the things that really stood out to me was the fact that you have the vast majority of the market who would characterize themselves explicitly, or you can implicitly see this in the way they've responded to our questions, that they are highly uncertain about what the right move is, how things are going to affect them, but they are still putting contingency plans in place in spite of that, because they've flexed that organizational muscle over the last few years, and they know that they have to respond, and that while mistakes will be made, making some sort of plan and moving forward with some decision is likely going to be a better outcome than sitting around and waiting, given just the weightiness of some of these different challenges and these policy changes that we're facing.
Yeah. Now, we don't have longitudinal data. We haven't been watching this over every administration. But there's always this period of uncertainty. When a new administration comes in, it takes a while for the policy to shake out, to know what direction you need to go as an organization. But it feels like the sentiment in the industry right now is more uncertain and more worried about impacts of this policy. So how does this play out in the contingencies that organizations are putting forth?
Well, as they're thinking through what some of their contingencies are, part of this is a question of what contingencies are even available to them based on their financial position and their staffing position. So do they have technology options available to address some of these challenges or to mitigate some of the pressures independent of the administration change that they're dealing with? Do they have the staff to do so? So one of the really important things I think to note here as we get into some of the specific contingencies that people are thinking through is, number one, when it comes to IT spend specifically, you've got about 75 of healthcare organizations that say, hey, we are not cutting spend. Either we are maintaining, or you've got just under half who say we're planning to increase or significantly increase, because they see that as they deal with staffing challenges, one of the top contingencies that people talk about is reducing staff to reduce costs. It's the easiest place to do that. We see a lot of healthcare IT companies, not just provider organizations, responding in this way. And the hope is that the IT solutions will be able to make them more efficient, find dollars to save, find opportunities for revenue growth. So there is still a view of the market where we're going to spend. What has shifted, however, is the lens that at an organization leadership level is being placed on those decisions. Over the last couple of years, we've seen more CFOs get involved in places they haven't previously been. And as you can expect, that has only continued. So that was, from a contingency plan standpoint, that was one of the things that stood out for me, is just either explicitly or implicitly the role IT plays. I know you had a lot of conversations specifically about some of these staffing responses and strategies. Were there any that were independent of IT that you felt were particularly prevalent as themes in the data?
I think it's interesting that one of the things I was really pleased by when we were conducting these interviews is organizations are not looking to cut where it will affect patient care as much as possible. They want to, where they are being forced to cut, they're going to look at IT, administrative roles, those types of roles that support the experience, but maybe don't directly impact patient care. Now, there are going to be some long-term impacts that we maybe don't see today. One example of that is the grant cuts that are happening in the academic medical centers. It's putting a lot of pressure on those organizations to look at other ways to take care of patients, and also look forward-looking at some of those underserved populations. How do we do the right research that includes their perspectives and their experiences, so that medicine can continue to evolve in the way that it needs to. So there's a variety of different ways that organizations are looking at this workforce restructuring, right? Some have proactively looked at layoffs or are anticipating layoffs. And ever since doing this research, we've already seen some organizations that have pulled that trigger. Just in the last couple of weeks, you see San Diego Health, Sharp Healthcare have both had layoffs, and in their press releases around those, they've talked about the impacts of the government and reimbursements. You're also seeing organizations that are freezing hires right now, or they're freezing their salaries in efforts to cap spending while they figure out what other levers they need to pull to help with their financial bottom line.
One thing that I thought was interesting is when it comes to some of the technology strategies, whether it's investing in new technology or just leveraging existing technology, part of the question is, can we really deeply understand our financial position? So there's a lot of cost modeling and broadening of the use of some of those financial planning and analysis solutions to really understand what is the real state of things today, what options do we have so they can make the best choices possible when it comes to where they cut, if they cut, or explore if there's other options available to them that they may or may not have explored thus far. The other thing that I think we see a lot of, and this isn't surprising, we probably would have seen an investment here regardless of what happened with the government, is just the role that AI is going to play as a strategic bet. And I think one of the big questions is AI just wishful thinking? Is it really going to, in cases where cuts have been made or there are hiring freezes, is AI actually going to deliver the kind of return on investment that organizations are hoping it will in order to shore up their financial posture and respond accordingly? I see all kinds of different things out there. Are there a couple things on the AI front that are standing out for you as important trends to know right now?
Yeah. I think one of the things that you pointed out earlier, Emily, is the role of the CFO in those decisions now as they bring in IT to their organization. I think organizations are going to be looking primarily at AI with that lens. What is the ROI that this is going to return from our organization right now as my margins are shrinking? How can this maybe replace staff or augment staff so that they can do as much or more than they did historically? It's interesting. We asked organizations 8 different areas. What do you think the impact is going to be of the government initiatives on the table from on a scale from significantly negative to a significantly positive impact? Almost every initiative is expected to have a significantly negative impact on their organization and their bottom line, as well as a significantly negative impact on patients. The only one that kind of bucked that trend was AI.
Yep.
And there's some hope in the industry that the government will do just enough to give the direction and the governance that they need to use AI effectively, but allow them the freedom to use it in ways that maybe aren't even seen or anticipated right now. So there's a lot of promise and a lot of optimism around AI, but you're right, it's very much in a pilot phase for most organizations right now.
I think that's a really good point with pilots. I use the phrase pilot purgatory a lot, of organizations who have done something really cool with whether it's AI or some other technology and have not figured out the way to scale and have the impact they had hoped. One of the ways that I think we see some of this disconnect from what's possible versus what's real is, while this study was primarily focused on healthcare providers, we did get the perspectives of vendors as well. We asked very similar questions. And when it came to AI, while that was the one that had the most positive outlook for both groups, vendors had a rosier lens there. And I think that may be because they are in the trenches, seeing what is possible with the technology. They know what their solutions can do. And the healthcare organizations, while still positive, are not quite as optimistic, because to them, they're answering questions about data privacy, governance, what other initiatives are they competing with? How do we get the right funding? How are we going to prove the ROI of these solutions? So one thing I would note, maybe for any healthcare IT companies watching, is that if you are betting big on AI as a differentiating strategy for yourself to say our solution can get you greater outcomes or do more, is don't just think about what the solution can do, but really think about how you are going to shepherd that pilot to the rest of the organization, because we do see a lot of amazing use cases out there, a lot of great case studies that we've published, others have published, but finding a way to consistently scale that to the rest of the organization is going to be really key to having AI have the expected impact on both providers and patients.
I think you're absolutely right. So let's talk a minute about reimbursements. It's obviously front of mind for everybody right now. It's the top category where they think it's going to have a far more negative impact on their organization. Medicaid especially, they're worried about cuts to Medicaid that we're already starting to see play out. How are organizations responding to this potential shift in their bottom line due to cuts to those payments, restructuring of some of those payment models? What are you seeing organizations doing?
Oh, this is such an interesting question. There are two schools of thought that are emerging, and I hope that the more positive outlook is what we see play out. But there's this bifurcation in how organizations see the potential for value-based care in this environment and how they're in the short term responding to it. So the bottom line for me is that value-based alignment is evolving into a true revenue strategy. And that can be in a positive or negative way. So in some cases, people are looking at the state of things and saying, well, given some of these financial pressures, this is sort of the pressure that we need as an industry to actually invest and get past that critical mass in contracts at risk to actually have our organization's revenue really, truly be impacted. We've seen historically in past KLAS reports, you need about 30% of your contracts at risk in order to really start to see some of the benefits. So if there's not a lot of funding coming in through traditional payment models, does this help accelerate some of that? So that's one of the positive things we're seeing. And there's even some great examples of payers and providers aligning around this and seeing what can we do to help each other be successful. On the flip side of this, I want to go back to something you talked about at the beginning, which is organizations are being very mindful and deliberate in where they're making cuts to try not to have this affect patient care as much as possible. However, this is probably the place where we are seeing the most potential for impact, and in many cases already very, very significant positions around that. So thinking through a couple examples that were brought up in the survey of organizations who are cutting specific lines of care to their rural populations because they don't have the reimbursements they need from that and need to pivot to higher revenue services, which obviously impacts patients' ability to seek care and has some long-term implications for just the health of populations overall. So we see these instances where people are exploring these upside risk models or capitated arrangements, and there's this catalyst for change and progress, while at the same time, really real impacts on patient care that are not just theoretical, but are actually real today and are decisions that have been made and are currently in the midst of being made.
Yeah. And I think it's really interesting when you look at the different organization types and where some of this is going to impact patients. I think of a conversation I had with a small physician practice, and this was a couple doc practice, and they're looking at potentially completely getting out of the way that they've treated patients before, moving to a concierge model just so that they can control the revenue coming in. Then on the other side, you'll have large health systems who have EDs, and you can't send those patients away from your ED if they're coming in. Now they no longer may have access to Medicaid. So now your payer mix is shifting on you whether you like it or not. So I think you're absolutely right that they're going to lean in more and more towards value-based arrangements. And maybe what we saw historically of, as we've done reports on this, where they say value-based care is going to hit the tipping point in 3 to 5 years. And then 3 to 5 years later, we do the study and it's going to hit the tipping point in 3 to 5 more years. And maybe this is the catalyst like we've seen in the past with some of these big industry events for change.
So in many ways, we've been talking about, aside from the positive note that we kind of ended on as the catalyst for change, a lot of, not doom and gloom, but a lot of places where there's uncertainty, we are seeing patient impact, a lot of uncertainties that are causing anxiety, changing how people are deploying their capital. When I talk to people, what they often are trying to understand is, should I be optimistic about the future, or do I really need to hunker down and create really dramatic contingency plans? How should I be thinking about this? So from the conversations that we had and what you saw in our research analysis, looking forward, do you feel like this is overwhelmingly negative, positive? It's probably somewhere in the middle, but based on what you're seeing, is there a direction this is moving, and are there things that organizations can do to move things and tip things in favor of some more positive outcomes?
I think the biggest piece of advice that I would give is just don't sit back and wait for anything to happen. You have to be proactive in situations like this. And we talked about some of those contingency plans, the financial modeling, the best case and worst case scenarios. All of that needs to be played out by the leadership of these organizations right now. And then responding quickly when some of those uncertainties become realities, like we just saw recently with the One Big Beautiful Bill that was just passed. So this research was conducted just before that became law. But those uncertainties, those contingency plans that the organizations had started to put into place, now they're triggering into real action instead of planning. And I think for provider organizations, the best thing you can do right now is don't be reactive, but also don't jump the gun. Get ready and then act as soon as something happens. What about the payer and the vendor side? What would you suggest they do?
For payers, because especially as we have the value-based care conversation, this is where I think maybe another provider best practice as well is just the fact that those collaborations are going to be lifelines in certain cases, and even small shifts in payer strategy can create some big relief for some organizations, and we've seen that play out in a few different cases. So on the payer side, their willingness to be transparent and flexible historically could be seen as something that strains their position in their network, but this is something that could really strengthen it because of the ability to move to value-based care because of the conditions. So really lean into that, see that as something that is really strategic and valuable, and be an effective partner with your healthcare organizations to figure out for yourselves, where are you planning on cutting patient care in a way that actually hurts our overall goals, and how can we work together to get things back on track? But it's going to require a whole new level of communication and trust that, historically hasn't been the top of people's lists of best relationships ever out there.
Yeah.
And then on the vendor side, you have to really evolve how you're thinking about yourself. You are not just a product, you are a partner in how the ecosystem is going to adapt. So tech spend is narrowing, it's not disappearing. The spend is going to increase, but providers are going to be very deliberate about where they put that. So your ability to really effectively draw the connection between what you are doing and the real ROI for them, that's going to be absolutely critical. It's going to have to be the biggest ROI and the most important type of ROI. So being really clear about where the ultimate value of your solution lies, instead of just here's a whole bunch of feel-good metrics, really getting ahead of that. And then thinking through, again, how do you help people get out of pilots? There's a number of reasons that people stay stuck there. And I think a lot of really effective upfront planning and best practices from the vendors who are seeing how this plays out at all of their customers' organizations can play a really key role, whether that's how to set those up effectively, how you're going to measure success, even deciding, hey, here's what the ROI should look like, and these things that you're shooting for are or are not possible. Instead, we'd recommend these ones, or here's what we've learned about training in order to roll these solutions out effectively. We've preached that at KLAS for years, but specifically as it relates to getting some of the new technology off the ground very quickly, that's going to be so much more important than it has ever been before.
You know, as you've been talking, especially on the vendor side, an example that I think of right now that where all of this kind of comes together, you've got AI, you've got pressure for the ROI from the vendor side. Ambient speech is one of those areas.
Mm-hmm.
So very rapid adoption in the industry right now. Almost every organization is doing something related to ambient speech. And it's a huge physician satisfier. They're seeing results where it's reducing burnout. Doctors are more satisfied. So having a great impact on the clinician experience. But now you're starting to see pressure from the CFO and other leadership to prove an ROI. It's not just, are my physicians happier or am I reducing burnout? What does that do to our bottom line? Are they helping us with coding? Are they helping us in other areas that will have a downstream financial impact? So I think that's a great example of exactly what we're talking about. Thanks again for joining us for this critical conversation on healthcare policy shifts in 2025. If you'd like to dive deeper, I encourage you to read our full report, Navigating the Uncertainty of Federal Policy 2025, available now at the QR code. On behalf of Emily, myself, and the KLAS team, thank you for the work you're doing every day to improve healthcare where you are. Until next time, take care.